Alyssa Jones Gardner, you have a quick comment or question?
Yes, a question and a comment. Why still using gross income to determine affordability instead of take-home pay? Because on paper, it may look like someone's making a lot of money, but in actuality, after taxes, after deductions, they may be making well below the poverty line, but that's not being reflected or counted. And that's also leading to a lot of working class people that are being made homeless in our city. Also, to Shammon's point about the other districts not kind of pulling their weight when establishing affordable housing, it's also political, like we saw in the last redistricting. If only one district is creating all of the affordable housing, that means your district is probably going to be the on the chopping block during the next round of redistricting, because you're going to have too many people in your district. So when it comes to changing the landscape, the political landscape, the voting landscape of a district, it's going to be us that continually gets attacked and gets put on the chopping block, so to speak. And it's going to impact many of our residents of color who are going to be cut and moved and shifted into districts where they are a statistical minority, where they wouldn't otherwise be if they were counted in District 10. And there is a way that we can put more pressure if we know people in other districts, having them advocate also to have affordable housing in their districts as well. Because again, if it's only being placed in the Bayview, that means we're always going to be cut when redistricting comes around, because we're always going to have way more people that we're servicing than any other district.
But definitely one in terms of gross receipts being determining income. That is something that obviously starts with the federal government, and that's something that they consider how that's their measuring stick for what someone's income is. Most certainly, we've done things here in San Francisco, like provide rental assistance programs and subsidies. We are working on universal basic income strategies for certain populations here in the city, and those are things that are going to help provide some relief when it comes to rent. But you're right, gross receipts should not be the way it's determined, because actual income, what you actually receive, really determines how you're able to budget and survive. And my goal and role is to do everything we can to subsidize and provide resources and opportunities for folks so that we can alleviate some of that burden, because that is how income is determined. And that's why I fight for the lowest threshold when we talk about affordable housing. I would say in terms of redistricting, I mean, obviously, folks did everything they could in their power to change the dynamic of District 10, even through the last redistricting process. A lot of people's goal is to try to separate the Black communities that still exist and sparse them so that they're not interconnected anymore. And that goes for obviously other people of color as well, but most certainly the Black community. You separate Potrero, Viz Valley, and Bayview from each other, and you're most certainly doing a number on the Black community and communities of color. There are focuses on changing the redistricting process, trying to make it so they're not necessarily appointed by the board in the mayor's office. Still many conversations about what that looks like and how to do that. But there are efforts out there to try to avoid a lot of what happened last time, which was very volatile, because to your point, population growth most certainly is putting District 10 in a position where we're going to see changes in the future when it comes to redistricting, and that has to be addressed equitably in the right way. So more efforts on that. Nothing finalized in terms of what the actual new focus will be around redistricting, but that is something that everyone is concerned about, and folks are doing the work on right now. Anietie, you're on mute, I think.
Thank you for that. And I wanted to sort of shift us because we have a limited amount of time today. And I wanted to sort of shift us over to really sort of talking about food access and food security. What things are being done in the district to address these things? How are ordinance requiring grocery stores to give 6 months notice before impacting community? Like, is that sort of in place? What things can we sort of look for? What things are you fighting for to sort of address food security, especially since the funding for food security post-COVID seems to have sort of gone away?
Well, I mean, we have some things we can be excited about as a district. We know we have 2 new grocery stores. We have a new grocery outlet on Bayshore. We have a Lucky store in Bayview Plaza. We actually made Food Co. make a lot of changes, providing fresh produce now, providing fresh meat in their butcher shop. I mean, they've stepped up in a lot of ways because we've pushed them to do that. They actually have to-go meals on site now where you can get fresh salads and different things that didn't exist a couple of years ago in Food Co. So pushing improvements. There are other things that we've done. There is going to be, and we're actually going to be kicking off the grand opening at the senior center because not the senior center, but operated by the senior center on 3rd Street, right next to where the Bank of America used to be. There will be a fresh produce, a fresh hub where folks can go get food called the Bayview Market. So that's a new place for folks who are identified and who have most certainly been suffering from food insecurity. We are doing everything we can to save a lot of the resources, to your point that you're talking about during this budget process. We get the mayor's budget on Friday and we'll really know what cuts look like and where we stand around cuts, but most certainly focusing on continuing to fund our food pantries, continuing to support the food bank and other programs that have been feeding communities is going to be part of what my focus is during this budget process as well. Yes, you've seen attempt by Supervisor Preston to put legislation together to say you have to give a certain amount of time to close grocery stores, and we'll have more conversation about that to try to make that a reality. Fortunately, at this time, I'm not aware of any stores closing. I'm only aware of grocery stores being on the way and coming into community. Some of you may know that we will have a market that will occupy where Fresh and Easy used to be, where Duckloy used to be. So that should be up and running pretty soon. And we have another avenue and opportunity to buy groceries and fresh produce right in community. So looking forward to that. We'll be having conversations with those owners very soon to make sure that that happens and continues.
That's great. What other public health programs are sort of being put in place? I think that you mentioned universal basic income, and for some that doesn't sound like a public health issue, but to me it actually does, because a huge part of public health has to do with stress. And I remember hearing you and others sort of talk about this, and how it sort of help relieve stress of people and sort of like improved health outcomes, but also financial outcomes.
Anietie, I'm sorry, can you repeat that? I think delivery man at my door.
No worries at all. What I was saying was, can you talk about some of the other public health programs? And I just interjected that, universal basic income for some might be considered a public health program because you're actually reducing stress. Like this was I think a pilot was done in relation to pregnant women in the city and county of San Francisco with amazing results for pre and postnatal sort of care and in delivery. So I just was wondering if you have any insight on other public health sort of programs in addition to the great work that's sort of being done around the food pantries.
Well, I mean, not in relation to public health and food insecurity per se. I mean, we've done a lot in terms of public health to address issues of folks with mental health concerns and provide alternative responses in community versus trying to lock people up, but really provide them with opportunities to be able to get help and support. Positive Resource Center has actually been working very well, and we have abstinence programs in place now, along with harm reduction programs, because we want to tackle the issues that exist on our streets around substance abuse and folks with mental health concerns. We have to do an approach that is going to work and address everyone's needs and concerns. We do have a brand new health center in the Southeast. A lot of you may have seen that, and most certainly all of our centers are operational, providing quality preventive care work. In some cases, outpatient surgery are happening right at our very own clinics here in community. But access to mental health support is something that we really are trying to increase, particularly for communities of color, to make sure that we have more clinicians, to make sure that we have more folks who can address concerns, because people with trauma and people with stress are having, are needing services more and more, particularly coming out of COVID, particularly in this time period where the wealth gap has increased tremendously in San Francisco. And we remain a place that is most certainly addressing a lot of health needs in the city, but we need to do a lot more in the areas of mental health and providing support for folks who need that level of support.
That's great. Thank you. One other thing, and this is sort of goes back to our question about sort of accountability earlier. How do we actually hold like people who deliver this food, whether it's the food bank or others, accountable, right? Like if it's a Lucky's, then if they had bad food, we can go to Google, we can tell our friends not to shop there. But places like the food bank, free markets, et cetera, how can we ensure the quality of that food? Do we call your office? Do we call 311? Is there any kind of sort of feedback loop that you sort of seen that people could exercise?
Well, anytime you have concerns with folks doing work in the community, most certainly feel free to reach out to my office. I know that the food bank and the nonprofits that they work with do have surveys about the services that they provide, surveys about the quality of food, surveys about what people like and would like to see. I know that sometimes they're able to make shifts and changes to be more culturally appropriate, to provide better quality food in some cases. But in some cases, when you are an operation like the food bank and you work off of donations and you work off of receiving goods and products from other people that want to support and help, they don't always have the level of choice that you want. And that's why I am excited about the market that's going to be on 3rd Street, because it's set up to provide more choice options, more choice opportunities in the area of produce, in the area of meat, in the area of your starches, to give people an opportunity to have more choice. But definitely you can reach out to our office. The food bank is providing their own surveys and most certainly taking feedback if you reach out to their contact list as well. And, they have tried to make some changes. I've actually seen it take place. But at the same time, it is a reality when you receive donations, it's harder to provide all the choices and options that one may receive from a typical grocery store per se.